Welcome to InfoSource, a presentation of Berkshire Healthcare Systems, a not-for-profit, consumer-centered organization committed to fulfilling the health and residential needs of the communities across Massachusetts we serve. I'm your host, Jennie Sutherland, and with us today are two lovely people from Mount Greylock Extended Care Facility, Human Resource Director Crystal Safa, and 2017 Profile and Care Award winner from Berkshire Healthcare Systems, Michelle Paglier, RN nurse. Welcome to the show.
Thank you. Thank you very much.
Pleasure.
Michelle, what was it like winning the award?
I was so taken aback. I just never thought that, doing something that I love every single day, that I would get an award for it.
Yeah.
So it's something I'll never forget.
So, Crystal, why does Berkshire give out awards?
So yearly, across the organization, staff is recognized for going above and beyond by exemplifying our core values and our mission and vision. They are identified and nominated by residents, co-workers, affiliate leaders, families, and then they are then passed on to a committee who reviews them and chooses and identifies the winners. This is a very prestigious award, the Profile and Care. It recognizes our staff, but it also shows them their value and that they are appreciated throughout the organization.
Oh, that's pretty awesome. So again, congratulations,
Thank
Michelle,
you.
for being an outstanding nurse. And why did you get into nursing?
After high school, I graduated in 2007, and I didn't know what I wanted to do at all. So I figured, I'm going to go to BCC to do liberal arts there until I figured out what I wanted to do.
Sure.
So as I'm there, my mom actually got diagnosed with breast cancer and a brain tumor in 2007.
Oh my goodness.
So, I mean, she's fine now. She's cleared of everything, which is amazing. So kind of, going through, all of her doctor's appointments with her and hearing, all the phone calls, I'm just like, this is what I want to do.
And you got interested in it
Yep.
that way.
I
That's
did.
really cool.
Yeah.
Were there any nurses that you knew in your own life besides
My
that?
aunt, actually, she's a registered nurse. She works at St. Francis in Connecticut, and she works in the NICU. And just hearing her stories throughout the years, how rewarding it was for her, that really helped me to make my decision too.
So you're glad you got into nursing?
Oh, 100%, yeah.
And you talked about nurses that helped your mom go through her fight, and your aunt working in NICUs. And so why did you choose to go into nursing at skilled nursing facilities, working with that population?
My first job, I actually worked at Kimball Farms Assisted Living in Lenox for 9 years. I was a waitress there.
Wow.
And there's something about the elderly population, and everybody has a story, and I would serve people. Like one lady was a Holocaust survivor, and it was just you hear stories of the men that were in the war, and it's amazing.
Yeah.
So there's just always been something. So that's why when I applied to Mount Greylock,
You were
so
set to go with
Yep.
that. Yeah.
Yep.
I mean, it's kind of a calling to work with that population. I think that's true for many of us who work with this population. The other thing I was thinking about is the work that you do with the residents. You have a lot of other folks that you work with, team members, other nurses, CNAs, different people in different departments. How's it like working with those folks?
really good. So on my unit, I'm on the long-term care unit at Mount Greylock, and the unit manager is Michael, and the charge nurse is Kathy, and they work very well together. I used to work on evenings, so I recently switched to the day shift, which is really nice, working side by side with them.
Sure.
And then there's a handful of the agency aides actually who are there once in a while at the facility, and they actually have applied. They want to come work there. They said they really enjoy it and being with the residents.
So that must be a good feeling.
It's really nice, yeah. Really, really nice.
All that work with those folks, are there times when you're caring for them that stand out to you that kind of have affected your life?
The residents?
Yeah, the residents.
There's actually one in particular that it just happened in the past few months. There was a resident at the facility, and he actually, the staff had to do CPR on him, and he ended up going to the hospital. He was there, I think it was for a handful of days or a week, but the first day that I started working at Mount Greylock, he was there, so it's been about 4 years, and we just clicked. There was just something about, him.
Sure.
So it's going to make me tear up.
It's all right. It's good. It's good work. I mean, the amazing thing is these people touch your life. The work that you do, I mean, you see in the moment, it helps folks. So
he was in the hospital for a while, and then my friend Amanda, who's a nurse at Mount Greylock, I'm sorry.
It's okay.
Her and I actually went to visit him at the hospital, and he was on a ventilator, breathing machine. And the nurse there, she was saying, she's like, he hasn't been responding to any anything verbal or responding to touch at all. He was there was really nothing from him. And so she whispered in his ear, and she told him that her and I were there, and he moved his whole head to us.
Oh, that's awesome. Yeah, I mean,
it was really nice, yeah.
You know, I asked you why did you want to work with this population and stuff, and when you tell a story like that, where you know that you have meaning in their life, and that moment had meaning in your life, that's why we do it, and to work with
it's
the
the
folks
power,
we
you know,
do.
the power and effect that we have on them, and also for us too. You know, their family, we're their family, and vice versa too.
Yeah. Well, thank you for sharing that, and all the work that you do there. Hello, Crystal.
Hi, Jenny.
Crystal, you have worked at several different Berkshire Healthcare affiliates, currently at Mount Greylock.
Correct. 2.5 years.
Along here with Michelle.
Yes. Michelle's wonderful.
And you've worked at another affiliate. How long have you been working with Berkshire?
In total, I'm coming up on 12 years this month, so that's a significant amount of time.
It is.
2.5 years at Mount Greylock.
Yep.
And just the growth, the help from Berkshire and the growth professionally and personally has been amazing.
Yeah. So you like staying there. It's nice to talk with someone 12 years, and you know you did 8 years at Kimball Farms and then at Mount Greylock. It's been a little while. I was trying to think, you and I worked together for a little bit there. So that was like 3 years. So it's like 5 years. So that's a pretty good chunk of your life working with these people. So thank you. Crystal, your work at Mount Greylock and the other affiliates, what's it like working at 2 of the affiliates?
Well, I think they all have their own atmosphere and their own culture. However, being umbrellaed under Berkshire, we all share the same key beliefs and core values that Berkshire instills in us. Mount Greylock, fortunately, is a small home, so we become more like family. Michelle's more like extended family than a coworker, and same thing with all the staff there, which is nice.
That's really cool. Well, you're making me want to go and work there. There are different opportunities. I mean, Michelle is an RN, a nurse. There's nursing opportunities. There's CNA opportunities. Are there other job opportunities at the affiliates for folks?
Yeah, so it's not only nursing. We also, each affiliate has various positions, whether it's dietary, housekeeping, laundry, or our activities department. However, every position directly impacts a resident's life.
Sure.
Dietary, the nutritional aspect of things is just as important as nursing care. So it's all.
And in those jobs, I mean, those folks are at these affiliates, these skilled nursing facilities and assisted livings, and it's 24 hours because it's their life. So there's different shift availability.
So there's definitely flexible scheduling. Opportunities, whether it's someone who's a first-time employee or, school requirements or just someone looking for some night hours or weekend hours. It's definitely flexible scheduling is something we're very familiar with.
I think one of the things about the schedule is there's opportunity for people to actually start working in dietary or activities. So it's kind of a good first job place, isn't it?
Yep.
And you see that a lot.
Yeah, we like to kind of grow our own, so it works well.
And I think we can all say that we've seen people start off as a dietary aide, become CNAs and nurses and things like that. So there's opportunities for growth there.
Most definitely.
Yeah.
I started as the nursing scheduler, and here I am today.
An HR director,
Yeah.
a scheduler. Well, I appreciate you coming on and talking about Mount Greylock and sharing your stories about the resident you took care of and take care of. You're making me want to go work at Mount Greylock. Do you need
Been
an
there,
assistant?
Jenny.
I have been at Mount Greylock. You don't need an assistant,
Well,
do
I
you?
would love one, however. Yeah, you've worked everywhere, so.
I've worked for Berkshire for a while, and I had the opportunity to grow within this organization too. I mean, I started part-time activity assistant, grew to an activity director, was able to be a program director on a dementia unit that I care very much for the folks with dementia and helping them have a better quality of life. And now I get this great gig, the community outreach coordinator for the affiliates in Berkshire County, and I get to work with all the affiliates in Berkshire County and for the residents who live in them. So that's a great feeling.
And you're also the host of the show.
I'm also the host
Don't
of the
forget
show.
that.
So I'm not going to forget that, which reminds me to check the time on the clock, which is telling me we need to take a break in a minute. So again, I want to thank you both so much for coming on. You
Thank you.
truly are good eggs and good people, and Berkshire's lucky to have you. The residents are lucky to have you, and you're lucky to have them as well. So thank you. All right, we're going to take a break. You out there are going to watch a little bit more about Mount Greylock, and when we come back, some more folks from Berkshire Healthcare Systems talking about Berkshire Healthcare Systems. See you in a few.
Nestled near the wooded and serene Springside Park, Mount Greylock Extended Care Facility is just minutes from downtown Pittsfield, in the heart of the beautiful and culturally rich Berkshire County in western Massachusetts. Mount Greylock Extended Care Facility offers you the best of both worlds. It's a locally run facility, staffed by dedicated healthcare professionals from the central Berkshire area. And it's backed by the expertise and resources of Berkshire Healthcare, the largest nonprofit long-term care provider in the area. Berkshire Healthcare is committed to fulfilling the health and residential needs of the people in the communities we serve. Mount Greylock is a proud recipient of the American Healthcare Association's National Quality Award. The Quality Awards recognize members' commitment to performance excellence by continuously demonstrating ever-improving value to residents and other customers. The Bronze, Silver, and Gold Awards recognize overall organizational effectiveness and capabilities and champion organizational and personal learning. At Mount Greylock, we pride ourselves on our deep commitment to our community. We offer a broad range of nursing home services, including short-term rehabilitation, skilled nursing, long-term care, hospice, and respite care services. We proudly offer an elegant home-like setting that allows our residents the comforts they expect while providing the care they need, including fine dining in our graciously appointed dining room, beautiful outdoor space, ample activities, and private family space. At the heart of it all is a focus on the body, mind, and spirit. Our rehab services include physical, occupational, and speech therapy. Our licensed therapy professionals help restore and maintain the body by focusing on helping our residents improve strength and mobility in order to participate in the activities they most enjoy. These services are provided up to 7 days a week when ordered by a physician. Mount Greylock is more than a place to live. It's a place to enjoy each day to the fullest. Our activities program focuses on the mind and spirit of our residents by offering engaging leisure and recreational activities, arts and crafts, music, discussion groups, exercise sessions, religious services, and cultural community outings and more. Each resident at Mount Greylock receives the highest quality care delivered by our dedicated staff members working as a team. From the nursing staff to our front office personnel, everyone is enthusiastic about the role he or she plays in the lives of the people who entrust us with their care. Our staff is committed to providing compassionate care, using teamwork as their guiding principle. We're dedicated to treating each person with dignity, recognizing their individual needs, goals, and preferences. We create a care plan for each person, focused on helping them achieve the highest level of independence and quality of life. At Mount Greylock Extended Care Facility, we're perfecting the art of superior care. If you or a loved one need short-term rehab, extra care after a hospital stay, or a nursing supervised full-time living arrangement, we invite you to tour and meet our staff. See firsthand how we enhance the lives of those we serve. To make arrangements or get more information, call 413-499-7186. We look forward to meeting you.
I want to talk to you about something.
Hi everyone, my name is Michelle Paglier. I am a 2012 graduate of Berkshire Community College from the nursing program. I'm currently working at Mount Greylock Extended Care Facility in Pittsfield, and it's a part of Berkshire Health Systems. And Berkshire Healthcare Systems is actually partnering with BCC to do a fundraising event to benefit the nursing program at the college.
Join us on the grounds of BCC on Saturday, October 21st for a 5K trail run, a 3-team member relay, and a 1-mile kids fun run. You can pre-register at the link below or the morning of the event at BCC. All money raised benefits BCC's nursing program. Berkshire Healthcare System affiliates will also be there participating in their annual cook-off and decorating contest. This year's theme for both contests is the 1950s. Food and fun for these events are free.
And I really want to thank everybody for participating in this event in the past years, and for those of you who are going to be participating this year as well. And this has really helped me in the nursing program, and it helps me help my friend Betty here.
Welcome back to InfoSource. Who do we have with me now? We have from Berkshire Healthcare Home Office Affiliate Support Staff, Employee and Recruitment Administrator, holy mackerel, Paula O'Haggerty, and Human Resource Associate Tricia Hillebrand. Hello.
Hello.
Hi.
Long titles.
Yeah.
So you guys are from Berkshire Healthcare's home office, and people need to realize that the affiliates have support from a bigger team that helps them with a big range of things from quality and nursing to human resources. And here you are, because we have quite a few employees across Massachusetts. Yes, no, maybe?
Yeah,
We do.
About 3,000.
That's awesome.
Yeah.
That's awesome.
Yeah.
And we're always looking for some more.
Always.
Always. So we're going to talk to you about how you can get involved with us, because after listening to Michelle talk
Yeah.
and Crystal talk, you just want everyone to come work with us and work with the folks that we take care of. Tricia, you're a benefits expert. So I was told.
Okay.
So I'm saying to everybody. Why don't you tell us a little bit about the benefits we offer?
Some of the benefits that we offer at Berkshire Healthcare, we offer affordable health and dental insurance. We have voluntary benefit packages for our employees, which can include supplemental life insurances, short-term, long-term disability benefits. We have a very generous pay time off program.
So that's vacation?
That is vacation.
Okay.
Yep.
All right.
It's a program that encompasses vacation, sick time,
Yep.
all into one bank that we do offer to our employees.
And you have some educational opportunities too?
We do. We offer what we call as a stepping stone program for licensed nurses.
Okay.
And we also do offer educational assistance programs as well.
Okay. And I've heard a lot of feedback from folks who have taken part with the Stepping Stone program, and they were super excited for the support that Berkshire gave them. And so that's for folks who want to continue on in their nursing education?
It could be whether you could be a dietary aide, you can work in housekeeping, and if you want to become a licensed nurse, Berkshire gives you that opportunity to become a licensed nurse, whether it be an RN or an LPN.
Oh, that's great.
Yeah.
I've talked to some folks who started and just went all the way through the program. And, and that helps us as well, and the whole community, because we're helping making more nursing staff.
Absolutely.
And there is, just a reminder, a shortage of nurses.
Yeah.
That we feel every day.
Yeah.
All right. Okay. Well, that was a good one. All right, you're off the hook for a minute. I'm going to go over to Paula here, who's just waiting to talk, I can tell. Paula, there's a couple other educational opportunities. I think one that I'm interested in is the shadow aid.
Yeah, so a lot of our facilities offer what's called a shadow aid program, where somebody can start at the facility as a shadow aid, shadowing the CNAs, and if they feel like it's something that they want to pursue, we will pay for them to get their CNA certificate so they can become a CNA at our facility. So it's a great opportunity for somebody to see, is this for me? Is this the type of work I want to do?
Yeah, and I think that's fantastic. clearly, because when you're thinking about, can I help care for somebody, you're not sure. And people go into this line of work with great intentions, and to have the opportunity and the support to try it out, I think it is really a great opportunity.
Yeah, it gives you a realistic expectation as to what the job is, and how rewarding it can be.
Yeah. Well, two great opportunities, the stepping stone and the shadow aid. And I think, there's so many things that I'm proud of that we do at Berkshire Healthcare Systems. And one of them is really trying to advance people. To hear Michelle, who was a 2017 Profile and Care Award winner, starting out at Kimball Farms as hosting and becoming this nurse and winning this award is a big deal, and hearing about her process. But that we actually support this in our staff is really cool. So how long have you worked for Berkshire? It's been a while. Wait.
23 years I've worked for Berkshire, yeah.
But you're only 25.
I know, thank you. Yeah, I started out in 1993 as a CNA at Berkshire, and worked my up to where I am today.
Yeah.
So very thankful for that.
Yeah, there's, again, I think I didn't do this on purpose. A lot of times I do things on purpose for this show, but this wasn't one of them. But then I started thinking about it. We're all, Yeah, so cool. All right, Paula. I went on a lot about your title and added some to it, I think.
It's a little bit of a mouthful.
What is it that you do?
So one of the parts of my job is to support our affiliates with their recruitment and help them with strategy and things like that.
All right. And with that, sometimes I know when there's opportunity to do job fairs, you go out and do those. How do people find out about jobs for Berkshire?
So there's a lot of different ways. You can go to any one of our affiliate websites or the BerkshireHealthcare.org website and click on the Careers tab, and you'll see a list of all of our open positions. You just scroll down to where you live, or where you might be relocating to, or where you know somebody who's looking for a job, and it'll show you all the jobs in that area.
Yeah, I talked to someone the other day who was thinking about moving out to the Cape, and he started the conversation with is I think I want to move out there, but I'm worried about jobs. And I said, well, you've been a CNA at this affiliate for a while. Why don't you go look online? And he went and looked online. He felt like so much better about that. So I like that it's out there, so people can see and kind of figure out if they want to move or looking for a job. There it is. And Paula, again, you can apply online.
You can express interest in a position online, or you can go directly to one of our affiliates and talk to one of our HR managers, and they can tell you exactly what positions we have available.
Yeah, somebody like Crystal.
Somebody like Crystal.
Yeah. Somebody like Crystal. I want to throw out there, too, there's a lot of volunteer opportunities at the affiliates. So activity directors are always looking for some more help with groups and one-on-one. So there's all kinds of opportunities to get involved. Really a moving story that Michelle talked about. So I like that a lot. I want to circle back to you, Tricia, about one of the benefits that I think is really cool and people would be interested in hearing about is the flex spending. Especially with a lot of things about health coverage and insurances coming up. So I want to make sure we touched on that.
Yeah, we do offer a flexible spending account too. It's available to all our employees at Berkshire Healthcare. They can take advantage of that benefit as well.
Okay, so something like money for glasses, is that?
Yeah, it's anything that normally is prescribed by a physician, you can usually run through your flex spending account.
All right, that's cool.
Yeah.
And then I had a question, because I didn't, maybe I wasn't really paying attention.
Sure.
The retirement plan.
Yeah, we do
Not
offer.
that I'm thinking of retirement. I'm so not close. Just like you, at 25, you don't need to think about that.
You need to start young.
Yeah.
Berkshire also does offer a 403B retirement plan, and there also is a company match. And that is available to all employees as well. So, even at 25, start young, start investing, take advantage of it.
Well, I want to encourage folks who already work for us and with us to think about this, because it's never, we are true, it's never too soon to start.
Never is too soon.
And I think as people look around at careers and jobs and stuff, you have to weigh what benefits are being offered, and it's not just, you know, the bottom line or the hours.
Yep.
Clearly in healthcare is the different shifts that are available, so it fits a lot of people's needs, but you have to look at benefits as well. And I think we make it really easy to apply for jobs. I mean, I went actually and looked online. I'm like, well, I could fill this out, and I'm terrible with the computer. It's about 2 seconds on there. So that being all said, we are looking for all kinds of folks out there. Paula, you see jobs in nursing, CNAs, dietary, activities,
laundry, housekeeping.
And again, a lot of opportunities to grow within the organization with the shadow aid if you want to go that way, and then the stepping stone.
The stepping stone too. I mean, I believe it's been in place since 2008.
Yeah.
And it's nice to see, you know, you have someone who goes through the stepping stone program, you know, they work as a floor nurse for many years, get experience, and then you see those people eventually flourish into a management role.
Yeah.
So, you know, it's a great opportunity that's out there if you want to become a licensed nurse.
Yeah. Well, again, I think Berkshire does a great job with helping to grow folks, to support them in their professional and personal development too.
Absolutely.
Again, I think we from our core values and mission and vision statement, just are a tight group organization that we should be proud of. So thank you two for coming on.
Thank you for having us.
I'm going to thank again Crystal and Michelle for coming on, because they were great.
Yeah.
And Michelle, when she was leaving the set, was worried about crying, but to me, I think that's the most honest and emotional thing you can do is have that response. So I'm so grateful for her and the many, many others that work for Berkshire Healthcare and all the affiliates taking care of folks. So thank you. Hope you come back again. Maybe we can talk about something else.
Sure,
You can
love
come
to.
and talk about your kids. Not that you have kids, because you're only 25. Anyway, all right. So I want to thank you out there for watching. I'm going to remind you that InfoSource is a presentation of Berkshire Healthcare Systems. Until next time, I wish you good health and good life. Bye for now.